Getting vaccinated against COVID-19 is a step anyone can take to stay protected from the virus. But when it comes to the health of Canberra's most vulnerable, getting a vaccine is perhaps even more important.
If they are to catch COVID-19, they have a high chance of becoming very, very unwell, perhaps because of underlying conditions.
The ACT Council of Social Service says it's been pleased with the local effort.
We've seen a very disappointing rollout to the disability community from the federal government, but we have seen some welcome actions by the ACT government with other vulnerable communities.
A feat that is in part due to Canberra's Specialty Access and Sensory Vaccination Clinic, which specifically caters for Canberrans with disabilities as well as their carers, allowing them to get vaccinated in a comfortable space.
High five.
From the 13th of September, the clinic's new home at the Weston Creek Walk-in Centre will allow it to open for 5 days a week. But there is still always room for improvement.
I think we need to see a lot more partnership and funding for community sector organisations to deliver vaccinations and in some cases testing to communities that are harder to reach by the government.
The latest data from the NDIS shows vaccination rates in the disability sector are on the move.
The good news is that the number of NDIS workers with a first dose has increased by more than 10 percentage points since the 23rd of August.
Currently, over 46% of NDIS staff have received 2 doses of a COVID-19 vaccine, while independent living residents are at 68%. Residential aged care is ahead at 85% double vaccinations. Overall, 44% of the over 5,000 NDIS participants are fully vaccinated against COVID-19. In the meantime, initiatives like Pat the Van are taking vaccines into the community, vaccinating those facing homelessness during the lockdown.
We're not restricted by having Pat when we go out and deliver vaccines. We have nurses and doctors who are going out without Pat as well.
That also includes those living in public housing, a group that has been a concern throughout this outbreak.
Since this lockdown and the outbreak in the ACT, we've actually extended those services to people living in other large housing estates,
giving all Canberrans an equal opportunity to get vaccinated. Madeline, ABC News, Canberra.